Welcome to this course on blood pressure measurement. In this lesson, we will learn what blood pressure is, why it is important, and how to measure it correctly. Blood pressure measurement is a basic clinical skill, but it is also very important for disease prevention and healthy monitoring. By the end of this course, you should understand the basic principle of blood pressure measurement and the correct way to use a blood pressure meter. Before we learn how to measure blood pressure, let us first understand why this topic is important. High blood pressure, as known as hypertension, is closely related to many major health problems. It is not just a number shown on a monitor. If blood pressure remains high for a long time, it can gradually damage important organs in the body. In early stage, hypertension often has no obvious symptoms. Many people may have high blood pressure for many years without knowing it. However, uncontrolled hypertension can damage the brain, heart, kidneys, and eyes. It may increase the risk of stroke, heart attack, kidney failure, retinal disease, and even vision loss. This is why hypertension often called a silent killer. Because many people do not know they have hypertension, therefore, regular blood pressure measurement is very important for healthy monitoring. The learning objectives of this course are follows. By the end of this course, you should be able to describe the basic structure of the cardiovascular system. You should also be able to define blood pressure and explain systolic and diastolic blood pressures. In addition, you will learn the basic principle of a mercury sphygmomanometer. You will also learn how to correctly use an electronic blood pressure monitor. First, let us briefly review the cardiovascular system. The cardiovascular system has three main components: heart, blood, and the blood vessel. The heart works as a pump. Blood vessel forms a transportation network throughout the body. Blood carries oxygen, nutrients, carbon dioxide, and metabolic waste. There are two major circulation loops. The first one is pulmonary circulation. Pulmonary circulation moves blood between the heart and the lung. In the lung, oxygen enters the blood and the carbon dioxide is removed. The second one is systemic circulation. Systemic circulation moves blood between the heart and the rest of the body. Through this loop, oxygen and nutrients are delivered to the body tissue, and the waste products are carried back toward the heart. The heart is a muscular pump located in the chest. Its main function is to pump blood throughout the body. The heart has four chambers. The two upper chambers are called atria. The lower chambers are called ventricle. In simple terms, atria connect to veins and receive blood returning to the heart. Ventricle connect to arteries and pump blood away from the heart. The heart also has valves. These valves help blood flow in one direction and prevent blood from flowing backwards. There are three main types of blood vessels: artery, veins, and capillaries. Arteries carry blood away from the heart. Because they receive blood pumped out from the heart, arteries need to tolerate higher pressure. Arteries have three layers: and the middle layer is thicker than that of veins. Veins carry blood back toward the heart. Veins also have 3 layers, but their walls are usually thinner. Many veins also have valves. These valves help prevent blood from flowing backward, especially when blood moves against gravity. Capillaries are the smallest blood vessels. They connect arteries and veins. Their wall is made of a single layer of endothelial cells. This thin structure allows exchange between blood and tissues. Now, we can define blood pressure. Blood pressure is the force exerted by circulating blood against the wall of the arteries. In other words, it is the pressure of blood pushing on the artery wall. Blood pressure is usually written as 2 numbers. The first number is systolic blood pressure, or SBP. The second number is diastolic blood pressure, or DBP. The unit is millimeter of mercury, written as mmHg. Let us use 120/80 as an example. The number 120 is systolic blood pressure. Systolic blood pressure is the pressure when the heart contracts and pumps blood into the arteries. The number 80 is diastolic blood pressure. Diastolic blood pressure is the pressure when the heart relaxes between beats. So, systolic pressure reflects the pressure during heart contraction, while diastolic pressure reflects the pressure during heart relaxation. Both values are important when we evaluate cardiovascular health. The concept and the management of blood pressure developed gradually over several centuries. In 1628, William Harvey showed that the heart derives blood circulation. This was an important step in understanding how blood moves through the body. In 1733, Stephen Hales performed the first direct measurement of blood pressure. He inserted a glass tube into the artery of a horse and observed the height of blood inside the tube. This method showed that blood pressure could be measured, but it was invasive and not practical for humans. Later, in 1896, Riva Roach developed a cuff-based mercury sphygmomanometer. This is an important step toward non-invasive blood pressure measurement. In 1905, Nikolai Korotkov added the use of a stethoscope. He found that specific sounds could be heard when the cuff press was slowly released. These sounds are now called Korotkov sounds, and they help us identify systolic and diastolic blood pressure. Let's look more closely at the Korotkov sound. First, the cuff is inflated above the systolic blood pressure. At this time, the cuff pressure is high enough to compress the brachial artery, so blood flow stops. Next, the cuff is slowly deflated. As the pressure decreases, blood begins to flow through the artery again. This blood flow is not smooth at the first time, so it produces tapping sounds. These sounds are Korotkov sounds. The first tapping sound heard through the stethoscope represents systolic blood pressure. As cuff pressure continues to fall, the sounds change and eventually disappear. When the sounds disappear, this point represents diastolic blood pressure. There are 5 surfaces of carotid cough sounds. First one is sharp tapping sound. The first tapping sound is used to identify systolic blood pressure. Phase 2 is swishing or whooshing sounds. Phase 3 is a softer dumping sound. Phase 4 becomes softer and more muffled. Finally, phase 5 is silence. When the sound disappears, this point is used to identify diastolic blood pressure. Therefore, in simple terms, the first clear tapping sound is the systolic pressure, and the disappearance of sound is the diastolic pressure. Now, let's go over the basic step of using mercury sphygmomanometer. Before using a mercury sphygmomanometer, check the device first. Place it on a flat surface and open the mercury reservoir switch. Make sure the mercury column starts at 0 mm of mercury. If it does not start at 0, the reading may be wrong. Next, check the mercury column. It should be continuous. If the mercury is broken or separated, do not use the device. Then, check the cuff, rubber tubes, and the ball. Make sure there is no air linkage, clotting, or loose connection. Finally, check the air release valve. This should be closed tightly and open smoothly. This helps control pressure during measurement. Before blood pressure measurement, it is very important to let the person reset quietly for a short time. This helps the body return to a calm and stable condition. Please sit on a chair with your back supported. Your back should rest comfortably against the chair, not leaning forward. Keeping both feet flat on the floor. Do not cross your legs. Crossing the leg may affect blood circulation and may change the blood pressure reading. Before starting the measurement, rest quietly for about 5 minutes. During this time, try to relax your shoulders, arms, and legs. You may also take 5 to 6 slow, deep breaths. Breathe in slowly and let breath out gently. It can help reduce tension and make the measurement more stable. During the measurement, keep your whole body relaxed. Try not to talk, laugh, move, or change your sitting position. Also, avoid looking too nervous or holding your breath. Even small movement or talking may influence the results. A relaxed body position helps us get a more accurate blood pressure reading. So, before we measurement, we should always make sure the person is sitting correctly and resetting quietly and feeling calm. Now, place your arm on the table. Keep your palm face upward and reset your elbow comfortably on the table. Try to keep your wrist steady and relaxed. Make sure your arm is supported and keep your arm at about the same level as your heart. This position helps prevent the blood pressure reading from being too high or too low. Next, we need to find the brachial artery. The brachial artery is located on the inner side of the elbow crease. Using 2 fingers to gently feel for the pulse. This is the place where we will later put the stethoscope. Finding the brachial artery correctly is important because this is where we listen for the carotid cough sounds. Wrap the cuff around the upper arm. Make sure the center of the cuff is at the same level as the heart. This is very important for an accurate reading. The lower edge of cuff should be about 2 to 3 cm above the elbow crease. The cuff should be snug, not too tight. You should be able to fit 1 to 2 fingers under the cuff. During the measurement, please stay quiet and keep still. Do not talk, do not move, and do not use your phone. Any movement or talking may affect the blood pressure reading. Put the diaphragm of the stethoscope under the cuff, on the inner side of the upper arm, near the bakary arteries. Then put the ear tip of the stethoscope in your ears. Make sure the meter is placed where you can see it clearly. You should be able to watch the mercury column and the scale during the measurement. When measuring blood pressure manually, you need to look at the scale and listen through the stethoscope at the same time. Now, we are ready to inflate the cuff. First, make sure the valve is closed tightly. Then, squeeze the ball quickly to inflate the cuff. Inflate the cuff until the mercury level reaches about 30 mm of mercury above the person's usual systolic pressure. After that, stop squeezing the ball. Slowly turn the valve to release the air. The pressure should fall slowly and steadily, about 2 mm of mercury per second. While the pressure is falling, watch the mercury column carefully and listen through the stethoscope. The first sound you hear is first throat cough sound. The number on the scale at that moment is the systolic blood pressure. Continue releasing the air slowly. When the throat cough sound disappears, look at the number again. The number is the diastolic blood pressure. So, remember, the first sound is systolic pressure, and the disappearance of the sound is the diastolic pressure. Here is a website link for you. You can watch the video and listen carefully to the throat cough sound. Try to identify the person's systolic and diastolic blood pressure. After learning how to use a mercury sphygmomanometer, we can see that manual management is not easy. We need to check the device, inflate the cuff by hand, release the air slowly, watching the mercury scale, and listen carefully for throat cough sounds. If the technique is not correct, the reading may be inaccurate. Also, mercury devices are less convenient for home use and may have safety and environmental concerns. Because of this limitation, electronic blood pressure monitors are now widely used. They are easy to use, quick, and automatic. The result is shown clearly on a digital display, and the user does not need to use a stethoscope or read the mercury column. This makes electronic blood pressure monitor very convenient for regular home blood pressure monitoring. Electronic blood pressure monitors are widely used in hospital, clinical, and at home. They are convenient and easy to use. However, correct technique is still very important. Before measurement, the person should rest quietly. The correct posture during measurement follows the same principle as when using a mercury sphygmomanometer. The back should be supported. The feet should be flat on the floor. The arm should be placed at the heart level. During measurement, The person should stay still and avoid talking. After the monitor finishes, record the systolic pressure, diastolic pressure, and the pulse rate. Even when we use electronic monitor, incorrect posture or cuff placement can still cause inaccurate results. Wrap the cuff around the bare upper arm. The lower edge of the cuff should be about 2 to 3 cm above the elbow crease. The cuff tube should be placed at the center of the inner side of arm and should extend in line with the middle finger. Leave about 1 to 2 finger width of space between the cuff and the arm. The cuff should not be too tight or too loose. The cuff should be in direct contact with the skin. If it is placed over thin clothing, make sure the clothing is not too tight or wrinkled. The current definition of hypertension is systolic blood pressure of more than 130 mm of mercury and the diastolic blood pressure of more than 80 mm of mercury. When we use an electronic blood pressure monitor at home, we should remember that one single reading is not enough. It may be influenced by stress, activity, talking, coughing, or body position. This is why home blood pressure monitoring should be done repeatedly. A useful method is the 7-2-2 principle. The first 7 means measuring blood pressure for 7 days. The first 2 means measuring twice a day, usually once in the morning and once in the evening. The second 2 means taking 2 readings each time. So each time you measure your blood pressure, take 1 reading first, then rest for about 2 minutes and take a second reading. This gives us more reading and allows us to calculate an average of blood pressure. The average value is usually more reliable than just one single measurement. There are several common errors in blood pressure measurement. Talking or moving during measurement may falsely increase blood pressure. If the arm is below heart level, the reading may also be falsely high. If the arm is above heart level, the reading may be falsely low. Using wrong cuff size can also cause inaccurate values. Closing leg may increase blood pressure. Measuring blood pressure over closing may reduce accuracy. Therefore, accurate blood pressure measurement depends not only on the device, but also on correct measurement technique. Finally, let us talk about how to prevent hypertension. Healthy lifestyle can help reduce the risk of high blood pressure. First, reduce salt intake. Eat too much salt can increase blood pressure. Second, eat more fruit and vegetables. A balanced diet helps support heart and vascular health. Third, exercise regularly. Physical activity helps control blood pressure and body weight. 4. Maintain a healthy weight. Being overweight increases the risk of hypertension. 5. Avoid smoking and limit alcohol. These habits can affect the heart and the blood vessel. 6. Manage stress and get enough sleep. Poor sleep and chronic stress may worsen blood pressure control. Finally, check blood pressure regularly. Regular monitoring helps detect high blood pressure early and allow treatment or lifestyle adjustment. In summary, The blood pressure measurement is a simple but very important clinical skill. Blood pressure reflects the pressure inside the artery. Accurate measurement requires correct posture, correct curve placement, and careful technique. Hypertension is a common but also has no obvious symptoms in the early stage. However, if it is not controlled, it can be harmful to health. Therefore, learning how to measure blood pressure correctly is important, not only for clinical practice, but also for personal and public health. Thank you for watching this video.